We're now here in the office about 10 months out from an operation in which we performed a decompression of the common peroneal nerve, but also removed her sural nerves. The sural nerves travel down to the outside of the heel, to this region here. And then we also released a superficial peroneal nerve that was stuck in an arthroscopy portal, because in December of 22, she had had a major ankle reconstruction procedure. You can see the scar here from the other procedure. She had a peroneal tendon repair, as well as ankle arthroscopy through 2 portal sites here. And she had what was called a microfracture of one of the cartilage structures in her joint, as well as a peroneal tendon repair and even a ligament reconstruction.
Prior to coming to Dr. Williams, after I had my ankle surgery, the pain never went away. It actually got worse after I had 2 new nerve blocks prior to my surgery. That pretty much never wore off, and then I had extreme pain going down my leg, on top of my leg, a lot of electrical currents. It was constant pain. It didn't go away. I had a lot of numbness post-surgery, so then I was referred to Dr. Williams, to where we went in and did all these additional surgeries.
The goal of this operation was to help restore as much sensation to the top of her foot as possible while removing the nerve to the outside of the foot. It was so painful, but painfully numb, that it was numb and yet at the same time very painful. We did not feel we could salvage that nerve, as there's other there are other incisions back here. We elected to remove that nerve and hopefully trade painful numbness for lack of sensation numbness and no pain at all. And so I can touch this now. How does that feel to you?
Just numb, no pain.
And before surgery, that was numb and you couldn't stand touching it?
It was painful, no. The touch it would drive me crazy.
Okay. And before surgery, we used to do this, and that would send a lot of electricity down your foot. Is that better now?
Yes.
Good. And so this area of her foot does have feeling. Occasionally she reports a twinge, but compared to before surgery, we're very pleased with this. It's been about almost 10 months now, or 11 months roughly, 10 months. Tell us how much improvement you think you have on that part of your foot.
I would say about 90%. To not have where you have the charges, you can't walk, you get zinged constantly all day long. You put a shoe on, it drives you insane. Now I don't have that. I just have the normal numbness. I can do a lot of the activities that I wasn't able to do prior to this surgery.
Great. So would you consider that portion of your case a success?
Yes, 100%.
All right. Thank you.
Mm-hmm.